Welcome back to our deep dive.
So we've been talking about carnitine.
And how important it is for the liver.
How the liver produces it.
Yeah, it uses it.
But then when you have cirrhosis,
Right.
it can lead to deficiency.
And that can cause a lot of problems.
Exactly. We talked about how
That deficiency can really mess with the liver's ability to function properly.
leading to things like hepatic encephalopathy
Muscle wasting.
and those muscle cramps.
Yeah. And we talked about how taking carnitine,
Might be able to help with those things.
it might.
The research suggests.
So let's dig into some of those benefits. I'm really curious about this hepatic encephalopathy.
What is that?
So that's that brain fog we were talking about
And it can be really scary.
because it affects brain function.
Like, how does that even happen?
So one of the main culprits
And hepatic encephalopathy.
is this buildup of ammonia in the blood.
And a healthy liver.
Normally filters out this toxin.
But cirrhosis makes that process much less efficient.
So it's like a clogged filter.
And liver's not filtering out those toxins as well.
Exactly.
It's not the clogged filter.
And that leads,
brain fog.
it can lead to cognitive impairment
Confusion.
and even coma in severe cases.
Oh, wow.
And that's where carnitine comes in.
That's where carnitine may be able to help.
Studies have shown
That supplementing with carnitine,
can actually reduce those ammonia levels in the blood.
so it's like giving the liver...
An extra boost to help it deal with those toxins.
You could say that,
Yeah.
and that can help.
And by lowering those ammonia levels,
Carnitine might help to improve mental clarity
alertness.
and overall cognitive function.
That's amazing.
So what about this muscle wasting? Yeah, so that's another area where carnitine shows promise.
And this is where we go back to those tiny taxicabs we talked about.
Okay.
The delivery system.
Exactly. So remember,
They're essential for transporting those fatty acids.
to the mitochondria where they're used for energy,
Right.
like fuel for the cells.
Exactly. And when there's a carnitine deficiency,
This whole energy production
that
process.
becomes less efficient.
And that can lead to muscle weakness and wasting.
Oh, yes.
So if you provide more carnitine,
You're basically boosting energy production in the muscles.
you got it.
Yeah.
And that helps to prevent muscle loss.
Exactly. And studies have shown that
Supplementation can actually improve muscle function.
and reduce the severity of sarcopenia in people with cirrhosis.
So it all comes back to...
Quality of life.
Exactly. You
Okay.
feel stronger. You feel more energetic.
You could do more.
You can participate more fully in life.
Exactly now.
What about these muscle cramps?
That we were talking about.
Oh, the muscle cramps? Yeah, those can be debilitating.
But there is some good news.
Research suggests that carnitine supplementation
Can actually help to reduce
and the intensity.
of those muscle cramps.
Oh, wow.
So less pain, better sleep.
Potentially, yeah.
I mean, we don't fully understand how it works.
But it's thought that carnitine
Might be able to improve muscle metabolism
and reduce the buildup of those waste products.
that are contributing to the cramping.
So it seems like
Carnitine can really help to...
manage a lot of those key complications.
It does seem that way
Yeah.
of cirrhosis.
And improve quality of life.
Early findings are very encouraging.
And remember, we also talked about
That preliminary evidence
that it might even help.
prevent liver cancer development,
That's really exciting.
even though we do need more research.
We always need more research.
But it's incredible that
One nutrient can have so many effects.
it really highlights
And that interconnectedness.
of our systems
Yeah.
and how important it is
To take that holistic approach to health. Absolutely. I don't want anyone to think.
that this is a magic bullet.
Right.
It's all about balance.
And, being realistic,
Absolutely.
as with any supplement,
There are potential risks and considerations.
to keep in mind,
And we always emphasize,
working with your doctor.
absolutely,
So what are some of the things
that people should
that
discuss.
their doctor?
That's a great question.
And that's a perfect segue.
Into the next part of our conversation,
We're going to talk about
practicality
of carnitine supplementation,
things like dosage
potential side effects,
and how it fits
into that overall treatment plan for liver cirrhosis.